and welcome to this week's module, Health Inequities and Public Health, Who Lives and Who Dies? I'm Dr. Kim Price, and this week we're going to dive into racial disparities in our healthcare system. Shall we go ahead and get started? Well, thank you for having me as a part of this overall course. I look forward to this module covering some of these vital objectives. These objectives will be covered in our lecture as well as in the materials that you can find on our Canvas page for this week. But first, let's get started with a few definitions. You may have seen this graphic representation illustrating the differences between equality and equity. Now, the World Health Organization defines health inequity as systematic differences in the health status of different population groups. So in other words, health inequity refers to avoidable differences in health between different groups of people. These widespread differences are the result of unfair systems that negatively affect people's living conditions, their access to health care, and their overall health status. Now, the root causes of health inequity is due to systems and structures that privilege certain groups and underserve or even actively oppress others through the unequitable distribution of power and resources. So where do we see health inequities? Well, let's take life expectancy, for example. Life expectancy is something that we use as a measure of the public's health. And in the United States, life expectancy has seen a steady increase for everyone since the Civil War due to advances in medicine. Only during the 1918 influenza pandemic, during World War II, and currently during this COVID-19 pandemic, we've actually seen a drop in life expectancy. But we still use it as a measure of the public's health. Now, we see health disparities and inequities in life expectancy. We see it right in our own backyard. According to census tract data in Catawba County, the average life expectancy in part of Longview is about 65 years of age, although the average for the county is 77 years. And in an area just about 5 miles north of Longview, the life expectancy is almost 83 years. Now, when we see drastic differences like this, it's important to ask why. Well, social determinants of health is something that we've been studying in public health for a while. Social determinants of health are the range of personal, social, economic, and environmental factors that influence health outcomes. Now, public health and our health department attempts to address these social determinants of health as they are generally modifiable through policies and through programs. Now, scientific evidence shows that significant disparities in health and in healthcare are based on social determinants of health and account for as much as 80% of a person's health outcomes. In addition to carrying the burden of housing stability, finances, and quality education, dealing with racial discrimination and microaggressions further the disparities in health. Race and ethnicity play a significant role in understanding the distribution of someone's social determinants of health. And while predictive, it's important to understand that race is a social construct, not a biological one. Scientists have not found genetic evidence that explains racial disparities in health. There's no genetic evidence that the groups that we commonly call races have distinct unifying genetic identities. There's so much variation within the races and commonalities between the races. So it's clear to us now that race is a social construct. So why does race seem to play a major part in these social determinants and ultimately health outcomes? Well, actually, it's not race, but racism that's the primary driver of the social determinants of health. The unjust differences in the social determinants of health, compounded by racism, lead to poor health outcomes. Now, in public health, we like to report statistics based on race, examining the distribution of morbidity and mortality. Now, some of these statistics are pretty well known. We know that African Americans are less likely to be insured. We know that African American women are more likely to suffer from overweight and obesity. African American children are more likely to have asthma, and African American adults are more likely to have hypertension. Did you know that only 8.7% of African American adults received mental health services compared to 18.6% of white adults? Even though studies show that racism is consistently associated with increased mental health conditions like depression and anxiety and psychological stress. Now, regarding infant mortality, there are 11 infant deaths per 1,000 live births among Black Americans. That's almost twice the national average of 5.8 infant deaths per 1,000 live births. Additionally, African American men are twice as likely to die from prostate cancer. African American women were just as likely to have been diagnosed with breast cancer, but almost 40% more likely to die from breast cancer. African Americans are twice as likely to die from diabetes and 2 to 3 times more likely to suffer from complications like end-stage renal disease and lower limb amputations. Research shows that racial and ethnic minorities are disproportionately affected by COVID-19. We look at hospitalization rates among African Americans and Hispanics, and they're almost 5 times the rate of hospitalizations for white people. But why? What is the common denominator? All of these health disparities correspond to the racial gaps that we see in household wealth and unemployment, criminal justice, education, and housing. These gaps in the non-medical factors or social determinants have persisted and lead to these health disparities or differences in health outcomes. Things may be getting better, but we still see those gaps. Again, we know that these differences are not attributes of race, but are the results of racism. The story doesn't end at just reporting these differences and announcing these statistics, but in understanding why. Why do we continue to see differences in health outcomes and other outcomes based on race? We know that after mapping the human genome, we know that it's not genetics, but in studying our history, many of the differences that we see are linked to how Black and Indigenous people of color have been perceived and treated over the years through systems of unfairness. The systems of discrimination based on racism have lingering effects in society and in our healthcare system. When we look at American history, we see how racism is embedded in our culture. From institutionalized, racialized slavery, to racist domestic terrorism, to Jim Crow laws and redlining, to police brutality and the abuse of civil liberties. In science and in healthcare, even though we know that race cannot be biologically explained, race as a social construct continues to feed how people are treated differently based on someone ascribing meaning to how you look. Some of you may recall Jane Elliott from an anti-racism exercise that she did on the Oprah Winfrey Show back in the early 1990s. She demonstrated how easy it is to learn prejudice and to learn hate with her blue eyes, brown eyes lesson. The audience of the show was unaware that they were being separated into two groups based on the color of their eyes. The blue eyes group was discriminated against, while the people with brown eyes were treated with courtesy and respect and hospitality. Negative stereotypes were attributed to the blue-eyed people. They were given a harder time, and they started complaining and becoming angry that they weren't being treated fairly. Now, the point of the exercise was to reveal that if you tell a group of people, whether it's based on eye color or skin color or even height, that they're not as smart or not as worthy as others, other people start to believe it and treat that arbitrary group of people unfairly. Skin color or race does not make a group of people superior or inferior. Systems and policies that were created and allow and perpetuate discrimination based on skin color or race, even though that physical attribute has nothing to do with intelligence or ability or behavior. But it's the systems and policies that allow that perpetuation. The CDC has announced that racism is a serious threat to the public's health. And we're going to continue this discussion in our next video.